out there on the streets is kind of hard.
We're incredible survivors.
I was going through a really rocky patch in my life.
That saying about one paycheck away from homelessness, trust me, it can happen to anybody.
It's hard, especially if you don't have no medical and you can't go see a doctor.
It's very important to have a place to come, and I'm speaking firsthand. I'm being homeless.
Being sick is actually a major problem. We don't need it.
Welcome to Stop Germs, strategies for reducing communicable illnesses in settings that serve people who are homeless. People who are homeless are vulnerable to communicable diseases. This video will help you to recognize and implement ways to minimize the transmission of communicable diseases. The tips and strategies in the video will help protect both you and the people you serve, because nobody wants to be sick.
Most people, when they're sick, they don't want to do anything, and when you're homeless, you have to do something. You have to get up and take care of yourself. You're on survival mode. Getting up and trying to find food or shelter or whatever when you're sick is really extremely hard.
The main ways that communicable diseases get around is through the airborne route, through coughing and sneezing, through direct contact, which would mean touching a person directly who has an infection perhaps on their skin, indirect contact, which would be touching surfaces that someone who was ill has touched, and foodborne illness. Food and waterborne is another way diseases get around. Contaminated food, or sometimes by the person who has eaten contaminated food and gotten sick, failed to wash their hands after using the bathroom.
It is helpful to remember these 4 ways in which we may be exposed to communicable diseases: airborne, foodborne, bloodborne, and direct or indirect contact. Shelter staff should develop and stick to a general communicable disease policy and implement procedures to block these modes of transmission.